Hello and welcome to another episode of Easy IVF. Today, we'll be talking about how to choose an IVF clinic. We've talked about a lot about IVF processes, IVF treatment, causes of infertility, but how do you choose the clinic that would work best for you? You know, there's just so many deciding factors when it comes to choosing an IVF clinic that might work for you. And there are so many reasons why people go to IVF clinics to get help. It might be to get treatment for infertility. It might be to preserve your fertility. It might be to have a diagnostic treatment. You know, there's just a lot of reasons why people go to a fertility treatment. So here are some of the things to consider when choosing a fertility clinic that is tailored to your care. Obviously, there are several types of fertility clinics and they all have pros and cons. The type of clinic that you visit doesn't really dictate the quality of patient care that you get. Some of the fertility clinics are in university hospitals. They are university based, and some are just hospital based. Some are operated by sole practitioners, so small private clinics, and some have a huge fertility networks that are kind of like interlaced and interconnected. Sole practitioners basically are known for their personal approach, and they have this one-on-one relationship with their clients, and you have a one-on-one access to your doctors, and you're able to get to them when you have questions. Whereas when you choose a large IVF clinics that have several doctors, you may have to see a different doctor every time you come in. And also you might be dealing with a lot of nurses and clinic staff more often than the doctors themselves. When it comes to the lab settings, larger clinics, they tend to have, you know, an in-house embryology setup that would be responsible for taking care of the embryo during and post-retrieval. When you go to clinics that are part of a network, some of the advantages that you get with that is that they are a large organization, right? So they are able to offer different financing packages compared to small clinics or compared to clinics that have no connections to other networks. They're also able to transport your specimen or your frozen tissue or your frozen embryos to other clinics easily at no cost, right? You don't pay any money for that. Fertility clinics in the university hospital, they are mostly research-based clinics. So larger clinics conduct research. So this usually means that if you're able to get in there, you can get discounts for if you choose to be included in an ongoing studies. This type of organization, they have access to significant amount of resources, and they are often well funded, and they can offer IVF at lower rates. So university hospitals tend to have cheaper rates than private clinics or smaller IVF centers. Also, when considering IVF clinics, you know, you might have friends that have been to some clinics and they speak highly of those clinics. So what works for your friend might not work for you, and the best IVF clinic in town might not be the best IVF clinic for you. This is because every IVF clinic do have standardized protocols that has been set without the holistic consideration of patients' needs. So say for example, some IVF clinics might do day 3 embryo transfers, and some IVF clinics might not do day 3 embryo transfer regardless of the number of embryos you have. Some IVF clinics might be flexible and do day 3 embryo freezing, whereas some IVF clinics would not. So depending on the services they offer, that might be more tailored to you. So depending on what kind of service you want and what kind of situation you are in, you might go for another IVF clinic over the best one because of the services they're able to offer to you. So here are some of the quality indicators to review when you are looking for an IVF clinic. The first thing you need to check is credibility. Does this program adhere to guidelines set forth by the governing body? Say for example, if you're in the UK, you will be dealing with HFEA, which is the Human Fertility Embryology Authority. If you're in the US, you'll be dealing with the ASRM, which is the American Society of Reproductive Medicine. And if you're in Canada, you'll be dealing with CFAX. You do want to check if the lab is accredited by the accreditation body and what the clinic's last accreditation rating was. You want to know if they are governed by these governing bodies and what kind of protocols they have in place for things. You should also check the bios of your physicians to ensure that they are board certified reproductive endocrinologists and not just general practitioners, or in some cases just obstetricians. And same with the embryologist in the lab. So what sort of education do they have? What sort of accreditation and experience do they have to do the job that they do? Some clinics display or showcase the names and the qualifications of their embryologists, and some do not just show the names and the qualifications of the people in the lab. But you should know that those are the people that actually work with the embryos, and the success of your IVF does not only depend on the medical team, also highly depends on the laboratory team. Once you know that the clinic is accredited, the next thing you want to look at is the success rates, right? So by now it's possible to have sort of like narrowed down the number of clinics you have in mind based on accreditation alone. So when it comes down to success rate, ask for the success rates for the past 5 years and average it, right? So do not just, when you go to a clinic and they give you a success rate for just 1 or 2 years, that does not really reflect the actual rate of that clinic. They might have been excessively successful in the previous 2 years, but what has happened in the last 3 years, or they might have been successful, just for last year. If you just have a year success rate, that does not reflect the quality of care. So ask for 3 to 5 years success rate and then average that. When looking at success rates, you should also look at the type of treatment that they've performed, the number of the treatment outcome, and inquire about how many women or men in your age category that they've treated at those particular clinics and what their outcome was. And then you can take it from. When looking into an IVF clinic, you should also consider the type of services they provide. Different fertility clinics do offer different services. I may only have a certain range of experience. Say, for example, some clinics offer egg freezing, but have never thawed a single egg. So you would want to find a clinic that has a lot of experience and data to demonstrate success and outcome. Some clinics do embryo biopsy and some clinics don't. Some clinics do pre-implantation genetic testing or pre-implantation genetic screening, and some clinics don't do that. So make sure that you check the type of services that you would want before going to a clinic. It will be very, very disappointing to be halfway into your cycle and discover that the clinic does not offer a very important treatment that you might want. Also, since there is a lot of fertility treatment available, make sure the clinics or the doctors you choose match your timeline, they match your speed and availability. And also the clinic should be aligned with your personal wishes and your budgetary needs. So you shouldn't go to a clinic that obviously is overpriced, or not overpriced, like that you can afford to go to. So basically make sure you know how much the treatment is and it's something that you can afford before even going into the door. Some of the more common treatments include, hormone injections, unstimulated cycles, IVF, ICSI, plus many other IVF add-ons. When talking about add-ons, I made a video on IVF add-ons, which one should you choose? So just make sure you look and watch that video to help you gain more understanding as to IVF add-ons. If you think you need IVF, make sure you find a clinic that has done a great deal of IVF and ICSI, at least more than 150 cycles per year, with slightly higher average success rates. Ask about counseling services and emergency contacts in case of adverse reaction with the meds or things like bleeding post retrieval. I've also made a video on the complications of IVF for you to watch. Choosing an IVF cycle, you should also ask them about their embryo freezing program and the survival rate of their thawed embryo. Say, for example, if you were to choose an IVF clinic that does have an embryo freezing program, but say, for example, a poor post-thaw rate, then it means that your frozen embryos would not have chances of, being transferred back in those clinics. Make sure that their thaw or survival rate is high, and I wouldn't give you a percentage right now, but just make sure it's over 70 or 80% for the embryo survival rate. So let's say if you've started with 10 IVF, at this point maybe you might just have 4 or 5. Once you're done getting information about those questions, ask about the embryology lab. So this department is often ignored when choosing an IVF center, but the quality of an embryology lab directly has an influence on your success rate. So it makes sense to inquire about the lab fertilization rate. What's the fertilization rate of the IVFs? What's the fertilization rates of the ICSI in the lab? And we also want to know the lab blastocyst conversion rate. So blastocyst conversion rate is the number of embryos that develops to day 5. Most clinic reports the blastocyst conversion rate to 40 to 65%. So if you have a blastocyst conversion rate less than 40%, that means that if you have 10 embryos, the possibility of you having the transfer is very low, because you would only have maybe 3 embryos that would get to blastocyst stage. The blastocyst conversion rate also says a lot of things about the culture medium. It says a lot of things about the cultural environment, the incubators, and the temperature and the environment that the embryo is in. So looking at blastocyst conversion rate, always aim for clinics that have a blastocyst conversion rate of 40 to 65% at least. Still on the lab team, you also want to know the backgrounds, the training, and the certification of the embryologists who are taking care of your embryos, and most importantly, the cultural environment and the lab setup. What kind of incubators do they use? Do they have witnessing protocols to avoid errors, to avoid like mistakes and errors in the lab? What kind of technologies do they use to enhance their work? How is the air quality and temperature controlled in the lab? How is the pH maintained? Do they have documentations for that? What's the protocol for that? Those are some of the questions that you might want to ask to see if you can get appropriate answers. At times, you don't even need documentation. Just see how those questions are answered. Finally, let's talk money. Money. So IVF can cost between 15,000 to 50,000 Canadian dollars. And depending on where you are, this includes the cost of medication and the cost of other additional IVF add-ons. I told you I'll have a link for IVF add-ons at the end of this video. So some of the questions you need to ask would include: how much would the whole treatment cost me? Will I be required to pay in advance? If so, how much do I need to pay in advance? And how do you set up the balance of the payment? How do you negotiate with the hospital or with the clinics that, okay, if I pay this amount right now, at the end of my transfer, this is how much I have to pay? Does the cost include the medication? Because if the IVF treatment cost does not include medication, you're going to pay about $2,000 to $3,000 on your medication, depending on where you are. If you have insurance coverage, you also do want to ask them about who will submit the bill to the insurance company. Is that you, or is that something they do, or is that something they might want to call your insurance company for? Does the total cost of the IVF treatment include the cost of embryo freezing and subsequent transfer? You might want to ask that, because if you pay, for example, $15,000 and that does not include the cost of embryo freezing and the cost of your subsequent transfer, well, you're in for the game. It means you still need to pay more money. If you are going to one of those big hospitals in the big university hospitals, you might want to ask them if there are any bursaries or if there are any studies going on that you can actually participate in to get discounts. I've made a video on how to get your IVF done for free, or at least cheap. I'll also leave a link for that. I hope you found this video very informative. Feel free to subscribe and leave a comment below. Thank you so much for watching, and cherish life.